Good evening, everyone. The purpose of tonight's meeting is to give you an update on where Highland Falls is in relationship to the COVID-19 pandemic. The last 8 months, as we all know, for everyone have not been easy. We have been given challenges that we have never had placed on us before. As of tonight, which will be talked about in a moment, we are in the yellow zone. So with these folks' guidance and us paying attention, hopefully we can get out of the yellow zone, and for sure we don't want to go to orange. My number one job is to protect the residents of this wonderful village, which of course involves our local economy. I will not allow Highland Falls to become a ghost town. We all need to be role models and wear masks, gloves, and use hand sanitizers as much as possible. The village has taken measures to actively mitigate the spread of this virus. Several times I have given masks out, gloves, hand sanitizers. I have the village employees at work wearing masks. Sanitizer, we have sanitized our parks, our playground, every day, our public bathrooms. We're working right now on an employee COVID-19 workplace policy. The new law requires the development of pandemic operations plan, more or less for the next time, which I hope will never come our way. I have been introduced to Zoom meetings, online training, online seminars. I even have meetings on the sidewalk in front of Village Hall. That's what we have to do these days. For me, I will rely on the data, the metrics, the science, and the public health experts, like Dr. Gelman. I am in daily communication with her. In fact, I call her a lot, and sometimes I cringe, and she probably says, "Oh, Joe's calling again." And even the New York State Health Department in Albany. So with that, I would like us to go down the line. We're fortunate tonight to have all three of these guests. Steve Newhouse, our county executive, Dr. Gelman, the Commissioner of Health for the County of Orange, and most people watching know Dr. Frank Sheboy from the schools. So thank you very much for taking time out tonight. I know you're running around, but we appreciate it. Steve.
Well, thank you, Mayor. I've known Mayor Joe D'Onofrio for decades. I was talking to the Deputy County Executive, Harry Poor, on my way in here today. I said I was introduced when I worked in the city of Newburgh. And Joe, we've been very close friends and worked together ever since then in many different ways. So I want to first thank the village and town of Highland Falls and the West Point community. We've worked very close together, closer than we ever have over the last 9-10 months. Every day on the phone, we do emergency management calls. It slowed down when the numbers started going back down, but now we're starting obviously to ramp up and deal with this again. We've had nothing but professionalism from Highland Falls and from West Point throughout the process, so I have to tell you, you guys have been good partners. Let me just tell you a snapshot of where we are today, and then I'm going to turn it over to Dr. Gelman and Dr. Sheboy. So we have about 18,564 people have tested positive from the beginning. You count the whole duration. We have 210 since yesterday. We've had 2 more deaths since yesterday, both senior citizens. So that brings our death toll, unfortunately, up to 547. 46% ICU beds available. And we have 110 people in the hospital right now. I want to just give everybody a quick deep breath because Highland Falls has been talked about the last couple weeks, yellow zone here, then we also have Newburgh and Middletown. Your numbers are significantly lower than those other communities. And the governor yesterday outlined a new metric towards shutting things down. He said if the hospitalizations, in particular the ones that are wanting critical care, go to a level that's 90% occupied, those beds, things will be shut down. So he realizes, and I think it's because of all the Association of Towns, which you're part of, as well, we all advocated for local business, saying don't punish business. If yesterday, he even reiterated that 70% of the new cases are from gatherings, not from you going to the pizza shop where you're required to wear a mask, but really when you're going to somebody's house and everybody says, check the mask at the door, this is a party, let's let loose. That's where many of our cases come from. So I want everybody that's a business owner to realize that you don't have to face the gauntlet that is going to be shut down tomorrow. I do want to emphasize that you need to do what the mayor said, and I'm sure Dr. Gelman's going to mention, is to do your best, do our part, your part, wear your mask, because at some point if those numbers get too high, they will have some repercussions which are going to hurt all our lives. We ended the phone call today. I do a call every day with the governor or his senior staff, depending on who is available and what's going on. 3 o'clock. We ended the call today that said, hey, keep your phones on, guys, in case anything comes up. And I said, whoa, hold on a second. Does that mean, are we expecting more announcements coming down from the second floor, we call it, in Albany? And they said, we're not saying that. So, well, you caught my attention when you said, keep your phone on. Because otherwise we'll say, I'll see you tomorrow at 3 o'clock. So I will tell you that the numbers are going up astronomically. Dr. Gelman and I have seen a significant increase over the last few weeks, and that will result in a number of changes. Hopefully not that it's going to impede our business, but it's definitely going to affect our lives. That being said, I do believe that we see the light at the end of the tunnel. Mayor D'Onofrio, the school superintendent, Dr. Sheboy, and Dr. Gelman, and I've been partners with this since March. And we've seen the uncertainty of where we're headed. We are definitely headed into rough seas right now, but I can assure you that the light is at the end of the tunnel. It'll be a rough couple months. It may be a rough 6 months, but I will tell you, it'll start to get significantly better as that vaccine starts being distributed throughout our community. The people that are going to get the vaccine first are nursing homes. Every day that goes by, Dr. Gelman and I are dealing with literally hospitalizations and death. And many of them are attributed to senior citizens and nursing homes. And they deserve, and I think they warrant, the first dose of, as well as first responders and healthcare workers. But it is critical that the nursing homes get help. We spent a significant part of our days trying to mitigate the damage that's already been done and being done, but they will be the first ones to get it. That being said, we are seeing other people. We've had a number of people that were very young, younger than me, I'm in my 40s, that have passed away in the last 5 weeks. So we don't want anybody to say this is just a senior citizen problem, I'm going to go out and do my party. Because one, you could be spreading the virus to somebody that you care about that's a senior citizen. Or two, you may yourself or somebody else that's very younger. I mean, we're talking, we've had people in our 20s pass away, we've had people in our 30s and 40s as well. So it is something to take seriously. We appreciate the cooperation we've had so far. This isn't an Orange County or Highland Falls problem. Throughout the state, you're seeing cases skyrocket as well as country. So, but we need to do our best here to make sure that we weather the storm and get out of this as quick as possible. So I'm going to turn over to Dr. Gelman, and after that, we're going to take some questions from the public. So Dr. Gelman, welcome.
Thank you very much, County Executive Newhouse. As you've mentioned, to date we've had 18,564 cases with an increase of 210 cases to date alone. Currently we have over 1,800 positive cases that are active that we are following. 316,751 residents have been tested to date. On average, we test a little over 2,500 residents per day that present. Some of these tests are repeat tests, however, the total number is actually indicative of the total number of individual residents tested, and those repeat tests are attributable to that individual. In terms of the data that we are seeing, so a majority of the currently active cases continue to be in the 18 to 44 age category. As the county executive has mentioned, close to 70% of all current active cases in New York State are related to small social gatherings. Similarly, in Orange County, we are seeing predominantly small gathering-related or densely populated areas and congregate facility cases. We have had a 10-day rolling average in September of approximately 10 new cases per day. We're currently well over 150 new cases per day, and we will actually reassess the 10-day rolling average very soon. Nursing homes are again being impacted severely with residents and staff with COVID-19 infections. I have to emphasize the fact that we have not yet seen the Thanksgiving-related gathering cases. We are anticipating to see those cases toward the end of this week or the beginning of next week. According to New York State, the Mid-Hudson Region Hospital admission rate increased by 148% over the last 3 weeks. As the county executive has mentioned, we have seen quite a few cases of individuals both in their mid-40s as well as even individuals in their mid-20s with no significant comorbidities. The individual that actually passed away recently, a couple of days ago, has had hypertension and diabetes as the only comorbidities noted in their clinical cases. What does the situation look like locally for Highland Falls? Through 12/7, so through December 7th, 37 positive cases in total. Of those, and this is a very typical question to our health department, about 46% of those total currently active cases are attributable to West Point. As far as schools and the impact of schools, the schools have not been open for in-person instruction for a prolonged period of time, but in the time that they were open, there were 8 positive cases. Of those, 6 were hybrid and 2 were virtual. 6 cases were from the high school and 2 were from the intermediate school. In terms of what we are seeing, just as a general breakdown of cases throughout the county, as of December 3rd, as far as cases in Orange County, total number of 17,575, and that just puts in perspective where we are and how rapidly we're experiencing this new growth in cases, where as of December 3rd, we've had a total cohort of 17,575, and we just reported to you that today the number is 18,564. In terms of what we're seeing for cases from the age category of 0 to 17, we have 1,440 residents who have tested positive as of December 30th, and that accounts for 8% of total cases to date. In the 18 to 44 age category, we have had 7,976 residents, and that accounted for 45% of total active cases to date. In the 45 to 64 age group, we've had 32% of cases, and that accounted for 5,550 residents. And 65 and 74, we've only seen 8% of residents, that's 1,324 cases. And 75 and over, and this is a very interesting statistic. For 75 and over, those were only 7% of total cases in Orange County, and that was 1,285 residents. However, and I will cite the death statistics in reverse, for that very same age category of 75 years of age and older, we have had 293 deaths out of a total reported as of December 3rd, 523, and that accounts for 56% of the total deaths reported as of December 3rd. The age categories of 65 to 74 and 45 to 64, we have seen a substantial increase in those categories, where the 65 to 74, we've had 22% of deaths, that was 115 residents. In the 45 to 64 age group, 18%, those were 93 residents. And the 18-year-old to 44 category, we've seen 4% at 22 deaths to date. In terms of what we are seeing in schools, especially in the aftermath of Halloween gatherings, we are most certainly seeing the numbers that we have seen during the first wave, especially the numbers that we have seen in mid-April of the first wave. Since my memo to the superintendents on November 19th, the COVID situation has continued to worsen. From the middle of September until the middle of November of this school year, more than 500 COVID-19 positive residents presented to public schools in Orange County while symptomatic. To be exact, that was 539 positive students, faculty, and staff that presented to public schools in our 18 school district while symptomatic. Those resulted in exposures for each one of those individuals of 30 to 50 individuals on average for each individual that presented in person. Of course, there were some with significantly less exposures. However, there were some with significantly more, to the tune of 200, 300 and up exposures. So in terms of what those 539 individuals presenting to school while symptomatic resulted in 21,000, just a little over 21,500 faculty, staff, and students who were forced to be absent from school, so just to clarify, under quarantine, mandatory quarantine for 14 days, due to the CDC required quarantine guidance. Of the positive cases in schools, the 539 that I noted for public schools in the 18 school districts, 78% were students and the rest were faculty and staff. This forced at least one or more of the public schools in 14 of our 18 school districts to close for COVID-19 exposure-related issues, including but not limited to isolation, quarantine, deep cleaning, staffing, and continuity of operations. All of the school districts in Orange County, that's 18 and they include approximately 83 schools, public schools, have had at least one positive case reported to the Orange County Department of Health. We have recently had one school in a yellow school zone that did attempt to revert to in-person instruction, and when I say recently, I mean it was reported to us on December 1st. And instead of closing as the other yellow school zones have done, they chose to revert to in-person instruction, and they saw a 40% positive test rate among those tested. So that's 40. In terms of this debate with transmission in schools versus community-acquired transmission, let me be very clear. We are experiencing broad community-acquired transmission at this point. That's not just a fact locally here in Highland Falls. That's a fact in Orange County, that's a fact across the region, and we are seeing an increase in numbers across the state. Just because transmission doesn't happen as significantly in schools doesn't mean that transmission that continues outside of school in a community or social setting won't impact continuity of school operations. That is precisely what we have seen in the aftermath of Halloween, and that is what the recommendations were based on. In terms of death data in general, and I think this is a topic the mayor and I discussed briefly, and this relates to the Forbes article that we were discussing before, and North Dakota cases that were cited as having, North Dakota, the state of, was cited as having the highest rate of death worldwide because their population is slightly over 700,000 people. And that was a very, very interesting and poignant statistic because with the North Dakota population of 762,000 people, they've experienced 954 deaths according to the Forbes article. So if we are to compare that to the Orange County, New York population, which is slightly over 380,000, with the 547 deaths that we reported, that would put North Dakota, as reported in the article, of having close to almost 1 in every 800 residents that have passed away from COVID-19. Currently, Orange County has had 1 in every 703 residents pass away due to COVID-19. And this is not COVID-19 related, this is actually due to COVID-19 as certified by a medical doctor or our medical examiner's office. So it's a very serious issue. We do take it seriously. In terms of just a basic comparison to the flu, because we hear this quite frequently, any average flu season in the U.S., in the United States, because this is aggregate data and only aggregate data is really available, just to put it in perspective, in the U.S. annually, on average, we see about 50 million cases of the flu over the flu season, which is about a 6-month span of time. In terms of complications and hospitalization rate percentage for flu-related complications, it stands at 0.01%, which accounts for about 500,000 flu-related hospitalizations and complications that are reported nationwide. The death rate stemming from flu-related illness is 0.001%, which is approximately 50,000 residents nationwide, again happening over a 6-month period of time. For COVID-19, those same parameters, 80% of individuals will have mild symptoms that will resolve on their own. 14% of individuals will be hospitalized or present to a hospital setting with complications, and 3 to 4% of individuals will die of COVID-19. So when you put that in perspective, and instead of a 6-month period of time of the flu season, you apply that to an 8 to 10 week period of time, that contributes to that surge in new cases presenting to all facilities at the same time, as well as that concurrent presentation of cases that we have to follow. Clearly not the 6-month flu season that we're faced with. So in terms of quarantine versus isolation, just to clarify a number of terms, isolation happens for individuals that test positive for COVID-19. Not antibody testing does not count. This is either via rapid test or the confirmatory PCR testing, which is the gold standard. So isolation happens for positive individuals, individuals that tested positive for COVID-19. And in order to clear that isolation, it takes 10 days as well as the resolution of all symptoms. So the individual has to be asymptomatic and have no fever, and 10 days have elapsed since they either tested positive or were initially symptomatic. It's very drastically different from quarantine. Quarantine parameters are 14 days. That's due to the incubation period of the virus, which is 2 to 14 days, as we've heard. And quarantine happens for individuals that are asymptomatic and quote-unquote otherwise healthy, who are either exposed to a COVID-19 positive individual, work in a high-risk setting and have had that potential exposure, or travel to an area of high prevalence. The reason quarantine is extremely important, it's important to stay for that duration, for the remainder of the quarantine, for the 14 days duration. It's really important to stay in that quarantine and not continue with activities of daily living, simply because you may incubate that virus, and once you incubate it, you become contagious, and you may potentially pass that on to others. The reason I bring up the difference between quarantine and isolation, and the resulting, of course, communicable disease investigation and contact tracing, it's simply because of the new parameters for the CDC potentially shortened criteria for quarantine. I have to emphasize the fact that the New York State Department of Health has not currently adopted these new CDC regulations. The coronavirus incubation period has not changed and is still 2 to 14 days, meaning an individual that's exposed to a positive will incubate the virus within 48 hours to 14 days. It could take anywhere between that time frame for you to actively incubate that virus and become infectious. The new CDC quarantine guidance is based on economic, social, behavioral recommendations, and the hope that the public will be more likely to adhere to the shortened duration of quarantine. However, we have not seen that compliance with masking nationwide. The nationwide masking compliance has been at about 46%, and currently preliminary surveys for immunization have revealed that about 50% of the population is likely to actually obtain the flu vaccine. So that does not leave a lot of hope for that compliance effort. However, the clinical and medical aspect is still there for the 2 to 14 days. The CDC still supports the longer period of 14 days as the safest option. Therefore, both our guidance and the New York State Department of Health guidance has not changed. In closing, what I would like to emphasize, as the mayor and the county executive have mentioned, with the upcoming holiday season, it is extremely important to avoid social gatherings that have been mostly responsible for the propagation of new cases and for the increased total case volume that we have seen. Travel, really rethink travel for this upcoming holiday season, as that is another mode of transmission, as well as just holiday gatherings in general. Where can you be tested? Anthony Wayne State Park is still operating, so that's the New York State run website. Our medical facilities, your doctor is still the best way to go. If you are symptomatic, of course you will be tested as long as you fit the clinical criteria. If you are asymptomatic, you will still be tested as long as you, again, fit the criteria, whether this is job-related testing and you're asymptomatic, whether you've had that exposure to COVID-19 positive person and you need to be tested, you could still be asymptomatic and need that testing, or this is travel-related testing. So with that, I would like to pass it on to Dr. Shivoy.
First off, I'm glad to be sitting to the right of Dr. Gelman because she covered almost everything for the schools and quite well. As the community is aware, we delayed our opening. We had some barriers and some challenges, but finally we were able to open our schools on November 9th. I know it was later than most schools around here, but it was also the appropriate response for our school and our community. Shortly after that, we had our first cases at the high school, which forced us to do massive amounts of contact tracing and notification. We don't actually do the tracing, the state does, but notification. And as Dr. Gelman alluded, a small number of cases, especially in a high school where students move, can very quickly limit the functionality of school and impair the continuity of learning. So what we found is very quickly we didn't have enough substitutes to remain open because we had that many faculty and staff who were on quarantine. Subsequent to that, we had other cases, and then based on the recommendation of the County Health Commissioner, we elected to go with a holiday pause through Martin Luther King holiday. We believe it was the best decision in our community's interest, especially on the heels of notification that we had a school in a yellow zone, and the testing parameters, which seem to change fairly regularly from the state, are just arduous as far as trying to get through. We're working on testing protocols. We have a committee that's working out, trying to get our testing, should we need to test children and faculty and staff. But that takes time. It takes partnerships with health providers. The district by its own cannot do that, so it will entail having other people. We do have a robust instructional plan virtually. It is not the same as having our children, and our goal is to have our children in our buildings every day. We're not there. We are not confident that without a vaccine we'll have everybody every day, but we will work very hard to get our kids back in school and have them stay back in school. We've operated from number one premise of health and safety for our faculty, staff, and children every day. And while children may not be the greatest number of impacted people, we have faculty and staff of all ages. We have families that they live with of all ages. And we have to be mindful that the school does not live in isolation. Our children are not residents. It's not like a bubble. And that we are a very important part of this community. We will get our children back. Our goal is the 19th of January. We're going to keep them back. But we need everybody's help, as has been said by, I believe, everybody here. We need people to complete our COVID screening, whether we're remote or in person. We need that done. First off, we don't want people to slip and say, oh, I forgot about it. We need to keep that habit. And you build a habit incrementally. We need people to wear their masks. We need people to socially distance. We need people to honestly assess their family and their children prior to going to school, even virtually. Take that temperature every day. Look at what the screening questions ask about. And keep people home if they're not well. That's the only way we're all going to get a handle on this virus, is to do our own part. So while you might just think it's a sore throat and a scratch, it could be COVID. You might just think you have an allergy, that could be COVID. It could be that you talk too much at meetings and you have a hoarse throat like I do all the time, but it could be COVID. And we need to make sure that we're not just taking care of ourselves, we're thinking about the larger community. And I want to thank Dr. Gelman again. Great job with the school information. I feel like I didn't need to be here, so thank you.
Thank you, Doctor. Mary Jane, do you have any questions?
You know, the only question I have is one I saw on one of the community Facebook pages the other day, and it talked about wearing your masks while you're walking down Main Street, or while your kids are playing at the park, or, you know, walking your dog. What is the latest on that?
So I don't think there has really been a change in the guidance, and we really have to look to why. What is the reason why we wear a mask in the first place? Currently, we wear a mask to contain our own droplets. This disease is spread via droplet, so this disease is droplet precaution. I know early on there was some reports of aerosolization of particles, not so much airborne transmission. This is not a true airborne virus such as the measles would be. So measles is highly contagious for an individual that has it in a room full of 10 unvaccinated individuals. 9 people will get the measles. With COVID-19, for every individual that has COVID-19, they will spread it to approximately 2 to 3 other individuals. Unlike the flu, where for every individual who has it, they will spread it to 1 other individual. So in terms of that aspect alone, we really look to what is the most, what facilitates that transmission. And as long as we can contain our own saliva and bodily fluids, and that's really the purpose of the mask, that's why we instruct individuals to wear that over your nose, over your mouth, and to really cover even your chin, because you ultimately don't want those droplets as you're speaking, as you're interacting with others, and especially with children, having 3 of my own, when they're touching with their orifices and then they're interacting with one another, to inoculate another individual's mucous membrane, because that's really the point and purpose of the mask. Now, getting into masks and in general, do masks work, do they not work, and that continued debate. Of course, varying degrees of efficacy based on types of masks, based on whether it's a gaiter mask or whether it's a mask that actually contains your chin so those particles are well contained. How thick is it? What type of material is it made out of? But not to get into a granular level discussion. Of course, any mask that's extremely thin or see-through will have a tendency, again, just think droplet containment. How do we best contain those droplets? If it's thicker, it's more likely to contain it. If it's thinner and see-through, it's more likely to aerosolize it as you're projecting, as you're speaking, as you're singing, or whatever activities you're conducting. So ultimately, when you think about it from that perspective, as you're conducting your activities of daily living, the goal is just to contain your droplets to yourself. And I think we tend to lose sight in really becoming accustomed to wearing a mask of really how clean is your mask? Are you washing it daily? Are you keeping it between uses in a separate compartment? Because I've seen individuals place it in their back pockets, just hanging off the ear, it's on the car, it's on the dashboard. We're taking it off at the front, which tends to be the contaminated area potentially. Also, as we're touching surfaces and fomites, inanimate objects, tend to not transmit as much. They don't hold the viral particles for a prolonged period of time. And I know we've amplified disinfection and everything else just in case that's saturated with those droplets. But the goal is not to have those droplets propagate. So as you're doing that, really be conscious of why you're doing it, and not just as a check mark to get into a store or a sort of a means to an end. It's really done as a protection to others because you're containing your own droplets. And the closer we get to 100% compliance, if every individual is wearing a mask, then we're all containing our own droplets. We're less likely to have that propagation and transmission.
And I think, Doc, the other question is, if a mom is at a park by herself with her 3 kids, they can take the mask off and take a mask break. But if you're walking down Main Street in Highland Falls and Joe is coming up on me, the mayor, Joe is coming up on me, we both wear a mask. And you might say, good morning, that's it. But if you're away from people and you're by yourself with your immediate family, okay. But if you're at a park and there's other kids playing and there's other moms on the other side, you want to wear a mask and set that standard, right?
Absolutely.
Correct. Anything else, Mary Jane?
Just one other question, because we were talking about it at dinner at my house tonight. Dr. Gelman, will flu season be better this year because we're all wearing masks?
We just discussed that, and actually globally, the evidence has shown that this flu season has been milder, and the reason I say globally is because we typically tend to have that distribution. It follows the same trajectory annually, where you initially start out in the Asian continent, then it moves on, we're talking about the flu or flu-like respiratory illness, follows that trajectory over to Australia, then we happen to see cases in Europe and the UK, and then they make their way over to the Americas. COVID-19 followed the same trajectory, so coronavirus, we've seen the same distribution of cases. That's why we tend to see to look globally of what their flu season looks like. As a matter of fact, we even tweak our vaccines to really see what Australia and UK are reporting in terms of their strains. In looking at the global flu picture, it is looking like a milder flu season, so you may very well be on the right track, because we were very concerned with that concurrent presentation of cases that I just mentioned for just annual typical flu season, which again, it could be worse, it could be better certain years. Thus far, knock on wood, we're seeing a better flu season overall speaking. And that's the case globally and locally, but it's very early, it's too early to
When
tell.
do you usually start seeing flu cases in Orange County?
Around now, I
Around
mean,
now.
we already have some reported cases, not just in Orange County, but statewide. And again, as I mentioned before, it's aggregate data, it's not necessarily individualized data. But ultimately, we are seeing a milder flu season. Hopefully, it's indicative of the remainder of the flu season, because the last thing we would want is those complications from the flu concurrent with the complications of COVID-19 hitting our hospital and healthcare systems.
Thank you.
All set? Thank you. All right, so I have just a few short announcements. First of all, I have hand sanitizer, masks, gloves, and children's masks. I have a limited amount, but if you, the public, want to come in and see me, any of these are here for you. Again, children's mask, adult mask, gloves, and I have hand sanitizer. So please just come into Village Hall, ask for it, and we'll set up a package for you right away, okay? Testing was brought up. I know there's a couple of sites in the county, but starting this Monday coming, the 14th of December, and the following Monday, December 21, here across the street from Sacred Heart in the parking lot, we will have testing done. You'll stay in your car, they'll do the swab, and you'll know within a couple of days the results. The only thing is needed is the application. It's a simple application. You can get it by coming into the Village Hall or going on the Village website and printing it. There's not much to the application. And then you have to turn around and submit it back to the Village Hall by Friday so that we can get the folks that want to be tested to the company, and it'll all be set up for a couple days later on Monday. If we're overwhelmed with folks that want to be tested, fine. They'll be here more often. I'll make those arrangements. So, and again, it's also open to anyone, no matter where you live in Orange County. So, but I hope that the local folks take advantage of that. Again, the application is downstairs or it's on the Village website. And just a couple more things. There's an old saying that we all have, you don't have to be old to know this one. We're in the best of times and the worst of times. And so we're in the best of times because the vaccine, we can almost see it. We see folks in England today getting the first shots. Ours, for those that are in nursing homes and healthcare workers, they're coming. That's the best of times. But the other half of that is we're also in the worst of times. It was said by my three friends here, to get out of the worst of times until the vaccine comes, we have to wear a mask. I wish I could say it stronger than that. You have to wear a mask. You have to wear a mask. It definitely helps. It definitely helps. It's our only line of defense until the vaccine comes. So the best of times are coming. We can see it for the first time in 9 months. But we're in the worst of times. The numbers are skyrocketing. When I heard over the last 2 or 3 days that I've listened to you, hundreds. It's sad. So please, wear a mask. I would, we can't get casual. It's easy to get casual. I kind of tend to do that, even myself. We can't get, we've done it for 9 months, just a little bit longer. Please, please, I'm begging you. 3 other items, they're quick. A tree was planted over at Roe Park, donated by a resident, a beautiful tree. It's planted, and that tree has been given to the children of Highland Falls. A tree is strong. We all know that. A tree is strong. And I want the children of this community that have been living through this just like us. I think sometimes we think, well, we know all about it, but they're hearing. They're hearing the news even though they're in the other room. They're hearing mom and dad talk. So they're involved. School, things just aren't normal. they know there's something going on. And so the children here and everywhere, but this tree was planted for the children of Highland Falls. So, because they're strong. The children in this community are strong like this tree that was just planted yesterday. It's over at Roe Park, you'll see it, it's by the pavilion, and I'm hoping that folks, children go over there with their parents and start to decorate it for the holidays. Whatever you want to put on the tree, you put on the tree. That tree belongs to you, the children of this village. Number two, in communicating with the doctor here, and Santa Claus, because before I talk to Santa, I talk to you, and Santa Claus is coming. Is that him? Santa Claus is coming to the village of Highland Falls. He'll be here on Saturday, December the 19th. Right after Army beats Air Force, Santa Claus is coming down Main Street.
They're not gonna be the Navy, you're saying?
No, they're going to be Navy. They're going to be Navy. So Santa Claus is coming again Saturday, December the 19th at 6 p.m. And he'll be right out here in the front of Village Hall. You'll come by in your car, because that's what the doctor said, and she's right. And he'll wave to you, and you'll wave to Santa. No touching. It's going to be good. It's going to be good. And the last thing is this, and I've had this program, as many of you know, for quite a while now. If you, I spend a lot of time on trying to figure out how we can help the businesses on Main Street, and we've come up with some things. And but one of them continues, so people know. You buy a $50 gift certificate at any store, a hardware store, a restaurant, Dunkin' Donuts, the beautiful bakery next door that Steve likes. And you buy a $50 gift certificate, you come to me and I will give you a free parking pass for Main Street for a year. So Christmas is coming, sometimes gift certificates are what people give. You give a gift certificate, it's for yourself, it's a present, come see me, I'll give you a parking pass for 1 year to park free on Main Street.
That's a great idea.
That's a good one.
That's a really good one.
So that's it. Does anyone want to add?
I'll just say one last thing. You mentioned about the best of times and the worst of times. One of the things we talk about on a daily basis is the America is always at its best at the worst of times, the most difficult times. That's when you remember key points in our history. We really emphasize on a regular basis doing your best to help your fellow neighbor. The elderly person, somebody that has maybe a disability, maybe because you're near West Point and it's part of your fabric, a lot of people are mobilized overseas, missing somebody in their family, need a little help. So we ask people to do everything they can. The other thing is, it's been tough mentally on a lot of people, everybody. Not one person hasn't suffered through this. So we really try to emphasize, if you have a problem, visit our website, orangecountygov.com. We have a whole page of resources for people needing assistance with mental health. If you dial 311, in our 911 center, we have now embedded people that are mental health experts to help people. I have somebody that has an addiction issue. I have somebody that has depression issues. What can I do? What resources are available? You know, the holidays are typically a glorious and wonderful time, and you can't see that loved one. Maybe you're separated from them. Maybe you've lost somebody. Maybe you've missed a lot of things that you wanted to do this year. So that's why we really want to tell and overemphasize how many opportunities and resources are available. 311, simple, remember that number, or check out orangecountygov.com. You click on the mental health icon, and there's a litany of resources. So otherwise, we just got to keep soldiering on. We literally, you and I see the light at the end of the tunnel, Dr. Gelman, and obviously Dr. Sheboy. We've been through this from the get-go together, and we definitely see the light at the end of the tunnel. We just got to stay confident, stay positive, and be strong. Doc, do you have any closing comments?
Just please, moving into the holiday season, the masking, travel, and social gatherings, limit them from, especially members outside of your household. It's imperative for decreasing that total positive case volume, just simply not to overwhelm our community resources. It's very important heading into the winter months. Thank you.
And just for me, I hope everyone enjoys a happy and safe holiday.
Absolutely.
Thank you so much. Thank you for tuning in. Thank you.
Thank you, Mayor, for having us.
Thank you.